Sri Lanka is an island nestled in the Indian Ocean with diverse landscapes, from sandy beaches and rainforests to mountainous terrain. With a population of over 21 million, Sri Lanka records a high literacy rate of 95.7%, with the average life expectancy at 72 years. Non-communicable diseases are a major health issue in the 21st century and pose a significant challenge to lower middle-income countries. Of them, chronic kidney disease is one of the major health burdens that Sri Lanka carries. An estimated 60,000 patients suffer from CKD in Sri Lanka. Organ transplantation is one of the greatest achievements of modern medicine. For people in end-stage organ failure, organ transplantation confers another lease of life. The demand for organ transplantation in the past decade in all parts of the world, including Sri Lanka, has been unprecedented. Due to the increased incidence of vital organ failure, the waiting lists for transplantation are ever growing due to the unavailability of adequate suitable organs for transplantation, leading to a major organ shortage crisis. Sri Lanka almost entirely is dependent on live donors. It is therefore of pivotal importance to ensure to increase awareness surrounding deceased organ donation. Sri Lanka commenced kidney transplantation in the year 1985. The need for kidney transplants has grown rapidly in the country, and today we have approximately 6,000 end-stage kidney failure patients. Sri Jayawardhanapura General Hospital was one of the very first hospitals to commence organ transplantation in the country. Our journey began as far back as the year 2000. In the past 2 decades, live donor kidney transplantation has gathered momentum, and up to this point in time, we have performed over 400 kidney transplantations at SHGH. We were the first center to introduce laparoscopic live donor nephrectomy in the country in 2014 to give the maximum benefit to the donor who is not a patient, deviating from the traditional open donor surgery. Today, we have moved towards 3D technology for living donation. Even with these advancements, we are still unable to cope with the ever-growing demand for organ transplantation. Live donor transplantation is unfortunately mainly limited to kidney transplants, and in order to venture further into multi-organ transplantation like liver, pancreas, heart, as well as increasing the numbers of kidney transplants performed, it is imperative to initiate a deceased donor program in a structured manner. It was in February 2016 that we performed the very first successful deceased donor kidney transplant at Sri Jayawardhanapura General Hospital, overcoming a multitude of obstacles. We wanted to take the idea of taking organ donation and transplantation to the next level by commencing an organ transplant unit at the Sri Jayawardhanapura General Hospital that same year. Our aim was clear: to implement a systematic structure and process to encourage deceased organ donation and transplantation in Sri Lanka. If there are no donors, there are no transplants. This is why raising public awareness was one of our very first tasks. In February 2018, we organized the very first organ donor walk in Sri Lanka. It was a resounding success, with the participation of over 3,000 people from university students, military personnel, healthcare professionals, and well-wishers from all parts of the country. On the same day, more than 2,000 donors registered for the program. 18th of February was declared National Organ Donor Day in Sri Lanka. The hospital set up a donor memorial wall in its premises, which is the only donor memorial wall of its kind in the country. This is in recognition of those who donated to give the gift of life to those in need. Each year on National Organ Donor Day, we continue the tradition of saluting these unsung heroes by adding a star to their name on this memorial wall. We also launched the National Organ Donor Card in collaboration with the Ministry of Health, which now has an ever-growing database of registered organ donors, which will bode well for the future of organ transplantation. The next step was to obtain support from societies locally and internationally to make organ donation a household name in Sri Lanka. The Organ Donation and Transplantation Foundation was founded by this dedicated team in order to promote this concept island-wide. Internationally, we continue to receive tremendous support from India, Spain, and the United Kingdom to promote and take forward this worthy cause. Prior to the pandemic, several workshops and webinars were organized promoting this concept to the masses of Sri Lanka. Regular workshops are being conducted within the hospital to create awareness among staff on varying aspects related to organ donation and transplantation. The first edition of the Organ Procurement Transplant Manual was launched in November 2021. Organ donation doesn't just transform the life of the recipient, it also adds value to the lives of their loved ones, friends and family. Sri Lankan culture encourages organ donation and transplantation, and it coincides with the concept of dana or almsgiving, which is deeply rooted in the country's culture and religion. It is with this intention that we formulated the Organ Donation and Transplantation Foundation. We will continue in our quest to create the much-needed attitudinal shift towards creating awareness and raising knowledge on the incredible benefits of disease donation and of the life-saving nature of this altruistic endeavor and the number of lives it will uplift. Although the concept of diseased organ donation and transplantation is relatively new to Sri Lanka, the team of clinicians at Sri Jayawardenepura General Hospital, in collaboration with multi-sectoral stakeholders, are keen on mainstreaming this worthy and life-saving initiative. Our journey has only just begun.